once you've done all of the prep work and treatment on the knee with the fascia blasters, this is where you can really go back in and do detailed work that even the most skilled fingers have trouble doing. So we're just gonna go ahead. I want you to go back to what you found in your entire leg. So if there were any spots that were extra sensitive, like say the inner thigh, you can use the poke and wiggle wiggle technique. You're just gonna go in and poke and wiggle wiggle, okay? So if you had huge chunks here, you could just do the poke and wiggle all the way around in that entire area. So what we're gonna do is we're just gonna do a 360 of the knee. Again, just doing the poke and wiggle technique. I am a little slick, so poke and wiggle is better done dry, so you can just wipe it. And we are going to come all the way around the entire patella, which is just a fancy word for the kneecap. Okay. With the poke and wiggle, again, if you find something that needs more attention, give it some intention. You are going to learn an awful lot about your body. Right this minute, I'm learning that my lateral quad that's going under the patella tendon is extra tight and that I need to go back and poke and wiggle some more later today. Okay. Also, don't forget, if you were experiencing extra tightness behind the knee, you can just go right in and poke and wiggle any of those tendons. You can do muscles, tendon, or fascia with the poke and wiggle technique. Okay. And then last but not least, I really like to get under the patella tendon. So one of these weird myths out there is that the kneecap is not supposed to move, but it is. It's supposed to move down, up, and side to side. So I want you to check yours and make sure that it is able to move. And if it's not, you want to give it, a little tugging and try to get it to move. If it doesn't move, you're going to want to continue to nug it until you can get the freedom of that patella tendon, because we don't want that thing scarred down. If it does move and you can pull it up, it is awesome to come right in underneath the kneecap. And I just retracted the kneecap backwards, and I'm taking the nugget and going right into the patella tendon. Can we have a moment to say, oh, it feels so good. And just poke and wiggle until you've loosened that knee. And then you can always go back and check and make sure that that kneecap has full freedom.